Hi everyone, my name is Nitin. I am an experienced OET trainer. In this video, we will learn how to transform an OET case note into a letter. In OET writing, we write a letter to a healthcare professional requesting a service for a patient. The healthcare professional can be a doctor, nurse, physiotherapist, social worker, and so on. We have a total of 45 minutes to attempt the task. In the first 5 minutes, we are only allowed to read the case note and we can write the letter in the remaining 40 minutes. How to do this? Let's learn with the help of a sample case note. I hope all of you have finished reading. Now let us pick the information that we need to include in our letter. In OET case note, there are three types of data: relevant data, semi-relevant data, and irrelevant data. Relevant data are information that are important from a reader's perspective. We need to include this information about the patient so that the reader can provide the appropriate kind of service for the patient. Semi-relevant data are data that are important from the reader's perspective, but they are detached from the main medical issue. These can be underlying conditions or past surgery that the reader need to be aware of. And the third one is irrelevant data. These are data that are not at all associated with the main medical issue. These information are not required for the reader to provide the right service. We need to omit these data from the letter because if we include these data, that can affect our score. So make sure that we do not include these data. Now, how to decide whether a data is relevant, irrelevant, or semi-relevant? That depends upon three main factors. First one is the reader of our letter. If the reader is a doctor, suppose, the doctor need to be aware of only those information that he need to give the right kind of treatment and assessment for the patient. And if it is a nurse, the nurse need to know only those information that she requires to provide the care for the patient. So that means reader is a main factor that decide the relevancy of a data. Second one is the purpose. That means to be precise, discharge plan or treatment plan. In the discharge plan, we come across information that the reader needs to do for the patient. So based on the discharge plan, we pick the data from the case note. So the data that are directly related to the discharge plan carries most importance. Now the last one is whether the case is known or unknown. Known case means the reader already knows the patient. That means the reader is already aware of the patient's condition, existing or past condition. So if the reader is known, we can omit the social history and medical history of the patient. And unknown patient means the reader doesn't know the patient already. That means we need to include appropriate or important social history and medical history from the case note. I hope that is clear for you. Now let's decide relevant, semi-relevant, and irrelevant data from the case note that you have just gone through. When you get a case note, firstly read the description. From the description, we'll get to know the name of the patient. Here the patient's name is Lionel Ramamurthy. He is 63-year-old and you are the charge nurse in the hospital. After that, go to the writing task and figure out who is the reader of the letter. Here the reader is a resident community nurse. That means we need to include only those data which are important from a nurse's perspective so that the nurse can provide the appropriate care for the patient. Next thing is check whether the case is known or unknown. You can do that in two manners. Firstly, if the reader is mentioned as the patient's nurse or Mr. Ramamurthy's nurse, then the case is known. The second way is match the address of the reader with that of the patient. Here, if you check that, you can know that the reader's address is Community Retirement Home, Newtown. And if you check the patient's social background or patient's address, you can see that the patient's residence is given as Community Retirement Home, Newtown. That means both the reader and the patient stays in the same facility. The case is known. That means we can completely omit social history, social background, and past medical history from the case known. That means because the reader is already aware of those information. Next, you can see that here one more information is given that the patient is returning back to the retirement home. The patient is going back to the retirement home and the letter will be accompanying the patient. From here also we will understand that the case is known because the patient is going back to the same facility where Ms. Georgina Portswood is the resident community nurse. I hope that part is clear. Next, we read the discharge plan. From the discharge plan, we can know that the patient needs paracetamol if necessary for chest and abdominal pain. So from here, we can know that the patient still has chest and abdominal pain for which paracetamol is required. Secondly, the second data is about the nutrition of the patient. The patient needs good nutrition including fluids, eggs, fruits, vegetables, and also requires monitoring regarding the diet. It is also important to keep the patient warm. So these are the information in the discharge plan. And after that, we will start to collect the data from the beginning. You can see the admission and discharge date in the case note. Both of them are important. We need to include those information in the letter definitely. And you can omit the residence. Actually, you can omit the residence. And then next of kin, that is also not important in this case because in the discharge plan, nothing related to arranging any meeting between the next of kin and the patient is mentioned. Also, the case is known. So, all those information are already known by the reader. Next is the diagnosis of the patient, which is pneumonia. Here, pneumonia is the main medical issue of the patient. So, definitely we need to include that in our letter. Like I told you, you can completely omit past medical history and social background since the case is known. And coming to the medical background, you can know that here the reason for admission is mentioned. Here the reason for admission are symptoms associated with pneumonia. The patient also had fever, rigorous sleeplessness, generalized ache, and so on. So here if you go through the case note, you will know that the pneumonia is already under control and the patient is afebrile, means patient is having a good recovery and the pneumonia is settled. That means you don't have to elaborate the symptoms of pneumonia. You can just simply write patient was admitted with suggestive symptoms of pneumonia. That will be more than enough. But you have to specifically mention the cough, chest and abdominal pain because those symptoms are still experienced by the patient at present. If you want to include fever and rigors, you can include. But anyway, I am not taking those data because the patient's fever is completely gone now. You can get to know that from the medical progress part. Now next you can see the patient's condition at the time of admission. We can see that the patient used pickup frame for mobilization and he was assisted with activities of daily living. He was very weak and ambulated only short distances and had increasing shortness of breath on exertion. From here also you don't have to include every point. You can include the pickup frame, like he used pickup frame for mobilization and he was assisted with activities of daily living. If you want to include the shortness of breath part, you can include that. Anyway, I am not including because at present that is not mentioned as a problem because at present shortness of breath part is not mentioned. That means the patient may not be experiencing that problem at present. Coming to the medical progress, you can see that the patient is febrile. Inflammatory markers are back to normal. You can include these data, of course, but or you can simply write currently he has made overall good progress. So that itself will cover both the data. Coming to the third, slow but independent walk and shower and toilet. This data is important because this specifies the current condition of the patient, which is important from the nurse's perspective. Next data details the symptoms experienced by the patients even at present. So you have to include this data because paracetamol, you can see one data in the discharge plan directly related to this point. Also, the nurse need to be aware of the patient's current complaint. So you have to write that one. The next one shows that the patient experienced weight gain after review by a dietitian. We can also include that because information related to patient's nutrition is mentioned in the discharge plan. Moving to the nursing management, all these data are important because you can see that the reader is a nurse. So nurse needs to be aware of the kind of management that was provided to the patient during his hospital stay. You can see that firstly the patient was encouraged to consume oral fluids and proper nutrition was also maintained. This is important because even in the discharge plan you can see points related to fluid intake and proper nutrition mentioned. Next one is ambulance as per physiotherapist review. Here we can include this because the ambulation of course needs to be continued after discharge. The next one is encouraged physiotherapy, deep breathing and coughing exercise. So this management was also provided to the patient during his hospital stay. And finally, he was preferred to sit down in order to ensure postural drainage. We can also mention that. And the current assessment shows that the patient has overall good progress, and that is pretty much clear. I hope the data selection is clear for you. Like I told you, we need to include only those data which are relevant or important for the reader to provide the right kind of service to the patient. I hope the data selection is clear for you. Now let's convert the data we have selected into a well-organized letter. When you write a letter, make sure you write the letter in well-defined paragraph. Your letter needs to be concise and clear. You need to include the relevant detail and omit the irrelevant data that we have already discussed. Now we will be writing this letter in 4 or 5 paragraphs. There are 4 critical paragraphs. Firstly, you need to write the purpose paragraph. Purpose paragraph means by reading this paragraph, the reader needs to be aware of what the patient's condition is or what the patient's main medical issue is and the kind of service expected from the reader. Here we can mention the title and full name of the patient, the purpose of the letter, also the main medical issue. We can also mention discharge plan here in the purpose paragraph. Next one, we can write the assessment paragraph. In the assessment paragraph, we will write when the patient was admitted to the hospital, due to what reason. Then we can write the condition of the patient during the time of admission. After that, the kind of service that was provided to the patient during his hospital stay. And finally, the current condition of the patient. These details we can include in the assessment paragraph. You can split the paragraph into 2 if the paragraph size becomes maybe more than 7 or 8 lines. Next one is background paragraph. Here in this case, we don't want to write or we don't have to write the background paragraph because since the case is known, the social history and past medical history is already known to the reader. So that means we can completely omit the background paragraph in this letter. And finally, we will write the recommendation paragraph where we detail the discharge plan. And at the beginning, we definitely have to write the identification part of the letter where we mention the today's date, address of the reader, salutation, reference and age of the patient and so on. Now we'll start writing the letter. On the screen, you can see the identification part of the letter. Firstly, we have written the today's date, then we have written the address of the reader, followed by the reference and age of the patient, and finally the salutation. And after that, like we discussed, we will write the introduction of the purpose paragraph. Here we have mentioned the title and full name of the patient, the current medical issue, the purpose. Here the purpose is continued care and management. That means the kind of care that was provided to him during the hospitalization needs to be continued even after discharge, and the discharge plan is already mentioned. You can see those information are written in simple, clear language. I'll read that. I'm writing to update you on the current health status of Mr. Lionel Ramamurthy. Here I have used this introduction phrase because the case is known. So if the case is known, you can use this sentence. I am writing to update you on the current health status of Mr. Lionel Ramamurthy. Then I have written the present medical issue, which is pneumonia. He is recovering from pneumonia, and that is clear from the case note because we saw that there it was written the patient currently overall has good progress and most of his problems are settled at present. So you can write he is recovering from pneumonia and requires continued care and management. He is set to be discharged today because the today's date and discharge date are same. That means the patient is ready for discharge today or he is being discharged today. Now we will write the assessment paragraph like we have already discussed. Here we will write the admission date plus presenting complaints, condition of the patient at the time of admission, the kind of nursing management and other services that was provided to him during his hospital stay, and finally his present condition. You can see on the screen, Mr. Ramamurthy was admitted on 4 February 2014 with symptoms suggestive of pneumonia, including a persistent cough, chest pain and abdominal discomfort. On admission, he was mobilizing with a pickup frame and required assistance with activities of daily living due to significant weakness. I don't want to make the paragraph too big, so I am splitting the assessment paragraph into two. Next, you can see during Mr. Ramamurthy's hospitalization, he was encouraged to maintain adequate hydration and proper nutrition. He followed a physiotherapist guided ambulation plan and underwent chest physiotherapy, including coughing and deep breathing exercises. To facilitate postural drainage, an upright sitting position was recommended. In this paragraph, we have written the kind of management that was provided to Mr. Lionel Ramamurthy. In the next paragraph, we will write the present condition of the patient. You can see at present, Mr. Ramamurthy has shown overall good progress. Although his movements remain slow, he is now able to walk, shower and use the toilet independently. He continues to experience some dry cough along with chest and abdominal pain. Following a review by a dietitian, he has also gained weight. So here in this paragraph, we have written the current status of the patient. So all these information are included in the assessment paragraph. Like I told you, if the paragraph is becoming too big, you can split it into maybe 2 or 3. Here the assessment paragraph is divided into 3 paragraphs. The final paragraph is recommendation paragraph, where we explain the discharge or treatment plan of the patient. You can see on the screen. I'll read through it. For ongoing management, please provide paracetamol for Mr. Ramamurthy if his chest and abdominal pain persist. Additionally, he requires a well-balanced diet, including adequate fluids, eggs, fruits and vegetables with regular dietary monitoring. It is also essential to ensure he remains warm. So that's the end of the recommendation paragraph. And finally, we can write a conclusion like, should you require any further information, please do not hesitate to contact me. Then finally, we can sign off the letter by writing yours sincerely. Since the reader's name is mentioned, you can use sincerely, yours sincerely. If the reader of the letter's name is not mentioned, you can write yours faithfully. So we write yours sincerely and then we write our designation, which is charge nurse. I hope this is clear for you. I hope you have received a fair amount of idea on how to transform a case note into a letter. If you require any further help or assistance in writing a letter or any other related modules of OET, you can write that in the comment box. I'll be happy to read it and respond that in the next video. So see you in the next video. Take care. Bye.